It can be fulfilling, but it can also be quite draining. So I'm wondering if any of you have ever felt like this. No, well, good.
Oh, no, yeah.
Okay. In the sense that you want to be everyone else's anchor, but there you are drowning in your own challenges. You know, who's there to help you? So what do you think are the two major tasks of caregivers? We know taking care of the person who is ill, but what else?
Taking care of yourself.
Yeah, taking care of us. So when we're in that role, we sometimes forget that there's an us in the equation. We're so focused on the other person. And then we forget that we're part of it too. And for our own health and safety, we have to focus on our needs and take care of ourselves first. It's sort of like that airplane message in terms of putting the oxygen on yourself so that you can be there for the person to help them. So I'm going to run through this checklist kind of quickly because I'd be curious how you would answer yes or no to any of these in terms of, do you have supportive family and friends around you? Do you have a hobby or a project that you're doing that's meaningful? Do you take part in a social activity group? Are you within 10 pounds of your ideal body weight? Do you use relaxation methods like meditation, yoga, or progressive muscle relaxation at least 5 times a week? These are pretty tough checklist guidelines, aren't they? And this, I think, is the hardest one. Are we getting 150 minutes of moderate exercise or 75 minutes of vigorous activity? Are we eating well? Do we eat at all? some days, right? We forget to eat. And are you doing something just for ourselves? Do we have a place to go that we relax and we actually can be ourselves and not have to hold up the superwoman, superman kind of costume? And are we feeling pretty good about setting priorities and managing our time? So this is a checklist actually put together by ACS in terms of how we doing as caregivers. We know that when it's satisfying and demanding, we have a lot going on. We've got many roles. We're spouses, partners, children. It's especially difficult when we're taking care of people in different generations. And so we're managing schedules, transportation, all of these things. We're doing that and still meeting the needs of everybody in the family. So how do we do it? We hustle. We have a lot of hustle, right? I love the way they define this in terms of how you survive through life every day. You just have to hustle. But I want you to know that this is, in the midst of all this, it's really important to take some time to evaluate what you can and you can't do. In our last presentation, we talked some about knowing the difference between what you can and can't do. And then also being willing to allow yourself to get help, to sort of share the work, share the responsibility, rather than do it all on your own. And of course, there are some things that you really want to hold on to, and some things you might consider delegating so you can free yourself up a little bit. What we all know is your experience is unique to your situation. And so how you experience it depends on who you ask, right? So we go through the same stuff, but we go through it differently. So how do we know when we're kind of in trouble with our caregiving role and task, and where we might have some of those yellow flags or red flags that are popping up that says, hey, I might need to do something a little different. So we're feeling down and discouraged or anxious most of the day, most every day. That we absolutely have no energy. We're so worn out. We're just collapsing and we barely can get through the day. We're crying a lot. It's normal to cry some, but are we crying all day, most every day? Do we find that we just can't seem to stop crying? That we're easily angered, so we find ourselves more irritable, short-tempered, impatient with everything. We're not sleeping enough, or we're sleeping too little. We wake up at 2 a.m. every day and we worry ourselves back to sleep. And we're not allowing others around us very much. We're sort of nose to the grindstone and we're just pushing through it, just gutting it out. And we're not allowing ourselves to do anything other than the caregiving role. and feeling, of course, completely overwhelmed and lonely. Also, we might have a lot of physical complaints. What we know is when we don't take very good care of ourselves, sort of like not putting gas in our car or changing the oil, it breaks down. And we find that the more stress we're under, our body's responding to it, and it shows up in a lot of somatic or physical complaints. So we might also notice ourselves doing things that we thought we would never do, in terms of whether it's yelling at someone or being unkind, or maybe we've taken up a habit of shopping all the time or doing something that we know isn't necessarily healthy for us, but it's a distraction, and we sort of find ourselves doing it to excess. And that can be eating or drinking as well. So that helps us know when we're in trouble, and I think if you've answered, at least 5 of these, it's worth noticing how you might be able to do some things different to take care of yourself. And I will tell you in the midst of all of this that suffering is optional. Sometimes we think that when we're dealing with someone who is in a lot of pain, that we have to join that pain with them. And sometimes as we love them, we can't help but feel some of that pain with them. But I will tell you that you don't have to stay there and suffer in the sense that you have to experience the intensity and the pain in the same way. And when I found this quote, I was a little bit torn about whether to include it or not, because it can be one that people are not quite sure what it means. But when I think of it, and I often provide support around this issue, is that we think that if we hold back on taking care of ourselves, that really is a noble thing to do, and that we're required to have that kind of suffering and pain because the people we love are going through so much. But what we don't really realize is when we do that, there's such a cost, and that a cost to ourselves, or a sense of well-being in terms of whether we can be there for ourselves or any other person in a healthy, supportive, loving, and joyful way. So what I'm here to offer you today are some options where you get to choose what it is you want to do, whether you want to keep doing things the way you've been doing it and feel the heaviness and pain you've experienced, or whether you might consider shifting some of that energy, some of that attention, some of those decisions into something that actually will be uplifting and actually help make you stronger, rather than feeling like you're just sweating it out and gritting it out. So how can we reduce this burden and this stress? We know it's hard, we know it's difficult work, and we can't just walk away from it. But the idea is, how do we get support to do it? So instead of it being my work, it's our work. It's the sense of, I can do this part, but I'm going to delegate that part. I'm going to share this, or I'm going to let that go. That doesn't need to be done, or someone else can do it. And also support from our community, from whether it's our faith, our friends, a support group, whatever it might be. How do we connect with them? We find that people who have a higher level of happiness and joy have a very good social support. So they're not feeling so isolated, and they actually allow themselves to be with others who can help them with whatever they're facing. Exercise and a healthy diet. I mentioned this before. I think you've had other sessions about the importance of exercise. What we know is that our bodies and our minds, our brains need exercise. If the extent of our exercise is cleaning the house and getting someone in and out of the car, or moving furniture, that's not quite the same as getting out for a walk, doing something that is more structured and physical, so that we actually begin to feel the physical benefits. So it's not the day-to-day activity, but actually doing more that allows our body to both release the stress as well as regain resiliency. So recreational time, just time to have fun. Yes, the caregiving role can be a lot of work, but having opportunities where you can either make some of the tasks fun or take a break to get away to have fun is so important to restore ourselves. Again, I use the adage of a car. If you're constantly driving it and you don't do anything of the maintenance or even fill it up with gas, what happens after a while? You're stranded on the side of the road. And so the idea is not to spend every bit of yourself in the care of someone, but find how you can give yourself totally to that role, but allow yourself recharging stations along the way where you stop and fill up and you allow yourself to get the care that you need so you can keep going. And then help from a trained mental health professional, not totally mental, but that could go either way, I guess. It depends on who you ask. But it is a matter of really finding people who have the skills to help you. Sometimes what you're going through is not something your best friend or your husband or your children know how to manage. They can be wonderfully supportive and encouraging, but they may not have the skills and the tools to really help you find strategies or be able to manage the way you're thinking about a situation so that you actually can have a different experience. And they may just not know how. So the idea is, how do you surround yourself with people that can actually give you what you need? And remembering that giving and receiving are two sides of the same coin. A lot of times caregivers get sick too. And I will often hear that, I don't need anything. I'm taking care of this person. I'm the person who is always giving. I just can't receive this kind of support. And the truth of it is, until we allow that ourselves to be filled up and supported, we really get burnt out and worn out so much more quickly. And we forget that the joy of giving and taking care of someone that says, we're doing something that matters. We may not be able to fix this person's illness, but we can be present with them. We can make a meal, we can clean a house, or we can do something that still helps along the way. Well, when you don't allow other people to help you, you're actually preventing them from having that experience too, as where they know that they're making a difference. Because people who care about you want to know that they can do something that matters, and helping them with actual tasks or the ability to be comforting or supportive is very, very helpful and important for their experience to be there with you. And you need them. You need them. So what makes caregivers effective? Obviously, empathy. Being able to experience some sense of compassion for what other people are going through. Respect, knowing that how you think of their experience and how they think of it might be different, and being able to take the time to find out, what do you think you need rather than what do I think you need. Sometimes we get caught up in sort of an anger cycle, in the sense of, have you had that phrase of, after all I've done for you? And so you are doing all of these things that you think need to be done, and the person you're doing it for says, that's really not helpful, or I really wish you wouldn't do that. And then you have the sense of, oh, wow, after all I've done. And what's happened there is not that people didn't appreciate you. There was just this disconnect between what you thought they wanted and what they really thought was helpful. And so having the sense of, how do we have respect for what people want that might be different than what we think they want or need. And actually allowing yourself to ask the question. Obviously being honest and genuine, flexible. Boy, flexible is the key, isn't it? It's one of the really important skills, is being able to adjust to, again, what I think you need and what you really are telling me you need is, okay, now I have more information, now I can do this a little differently or better. And then mutual participation, I've emphasized that again in all of those comments, is the sense of really talking openly with each other and the person you're caring for, asking what's important to them now, what's helpful for them now. So often I talk to patients and caregivers, and they are afraid to talk with each other because they think if they say certain things out loud, it's actually going to create more of a burden. that they'll know they're worried, or that they're upset in some way, or they can't do something that the other person thought they could do. So they are silent, and then they struggle separately, not being able to know whether they're doing the right thing at the right time, or they've thought of all the things that are important. And it is a matter of having those conversations, relieving some of that mystery, so that you can actually talk through what you need from each other. And it can be such a relief, because you don't have to play guess what I need, or guess if I'm doing it right. Healthy self-care, absolutely. For any caregiver, again, filling up your own tank, having a sense of humor. I love this. Every survival kit, it should include a sense of humor. Finding those little pockets and moments where you get to laugh at yourself or the situation or each other. And I'm sure you've had them. But sometimes when we're in such a serious mood and something goofy or silly comes on, happens, we don't even give ourselves the opportunity to laugh and notice the sort of the silliness of it or the absurdity of it. And we just pass it off rather than allowing that moment of levity. And then, of course, gratitude. Being grateful to each other for what you do have. I know there is a lot of loss when we're dealing with cancer and the experiences that we think we won't get to have or we can't do anymore. But being grateful to notice what you still have, what you still can do. Even sharing moments where you, together with your loved one, think back at all the wonderful memories you have, the wonderful experiences you've got to enjoy, and allowing yourself really to experience them and relive them in a way that is uplifting. And of course, then to ask for help when you need it. We can't all be all things to all people. There's a wonderful song that has a line in it that says, "You cannot do all the good that the world needs, but the world needs all the good that you can do." So it is a matter of, okay, what can I do? What energy do I have that I'm available to do this task? So with self-care strategies, we're talking about all senses of our being. A physical, to get enough sleep, take naps. I think they're lost on 2-year-olds. We need them too, right? Eating well, remembering to eat, getting some exercise and stretching, noticing yourself in your own body. Sometimes we get in this habit where we are constantly on the go, dragging our body with. You know what I mean? It's that sense of we don't even know when we feel hungry or angry or tired. We don't even know when a body aches and we need some attention, that maybe we need to slow down or get some medical attention. We just push through it. And so allowing those moments where you get to actually be present in your own body and noticing how do you feel. Where am I holding my tension? Would I appreciate a massage right now? Where can I get one? Those are the things that are really important to notice in your own body and being in the moment. Psychologically, reflecting on what's all this dialogue in my head? What am I telling myself about this? We give all of our experiences meaning. Do you know that by themselves, they don't have meaning? So this table, these chairs, being in Colorado, by itself doesn't mean anything until we say it does. Do you know that? So how you define your experience is how you choose to think about it. The language that you use, both for your own self-talk and how you talk to others, defines your experience. And that is important to notice. What am I really telling myself? When I say something out loud, how does it really sound? If someone, a third party, was listening, what would they think that meant? And is that what I mean to say? All of that is important in self-reflection, and it also helps us know where we want to tweak things. That, wow, I wish I could do that a little differently. What would that look like? How would it come across? How would I learn about that? How would I experience in that? Obviously, having time to smile, laugh, you'll hear that come up over and over again, that sense of release and levity. And solitude, time to really enjoy just being, where you don't have to do anything, just be. And of course, emotional, having your friends, your social support, being able to laugh as well as cry. Gratitude list, there's a lot of emphasis on really noticing what we're grateful for, and you'll hear it often. because that's where we find those moments where we go, yeah, life is good. Life is good. In this moment, I'm grateful for this. Taking a break, setting limits. I can do this, I can't do that. This is important, that's not important. And I will tell you over and over, and you know this, when you have something like cancer in your life, you start to get real clear about what your priorities are. And people over and over tell me that they start living their passions more than their obligations. And so all those things that you felt really responsible that you had to do, sometimes it's now a new choice about, do I really have to do that, and do I have to do it that way? Taking vacations, still allowing those times. You might not be able to go to Europe, but could you go to, I don't know, whatever, up into the mountains just for the weekend? Could you take a trip to go out on the lake? Could you do little mini vacations rather than the big things, allowing yourself still that break? Plan things that you really enjoy that involve other people. Now, there might be some things that you really enjoy, like painting or writing music or something like that that may feel more solitary. That's fine too, but make sure you're adding things that actually include other people. We find in the research that people who have a bigger social network and have core people of others that they really trust and enjoy spending time with are generally happier. So knowing that being isolated on your own, just gutting it out, is not going to get you where you need to go in terms of relief or happiness. And it will wear you out trying to do it all on your own. Having a project that gives you some sense of accomplishment. Exercising, obviously, is very important, or finishing a project that you've started. As far as whatever that is, you get to decide what gives you a sense of accomplishment. Doing things that feel good and are relaxing. So it can be very simple. It doesn't have to be something big. But having these key elements are going to make all the difference in the world that you make room for. So here's a nice little slide of different things that you could do, that you could take a break. And I'm hoping when you look at this, you can find at least 2 things that you find yourself saying, yes, I can do that. And if you could find 10, that's even better. Because the key here is when you're in the midst and the throes of all of your activities and responsibilities, you're not going to be thinking this way. But if you have a list, when you notice that you take a moment and you're actually in your body and you notice, I'm feeling really tired or I'm feeling really overwhelmed, what can I do to feel better? And if you can pull out that list and go, oh, I could do that. And if you can schedule an hour of your day where you look at that list, or 15, 30 minutes, whatever you can carve out, to say, I can do that for the next 15, 30 minutes, whatever it might be. Allow yourself to use that to charge yourself up. Did you find something on the list? Yeah? Okay. Did you find more than one? Yay, good, good. All right, so the idea is to create pockets of time that you actually build into your day, that you're resting, you're reflecting, and you're restoring yourself. So for some people that can be meditation or a mindfulness practice. And the idea is not to clear out your thoughts and actually abandon them, it's actually to stop letting those thoughts control you. So it's a sense of you notice them, and then you let them go. And it's sort of like watching fish in a fish tank. Have you ever done that? Where you sort of notice one that comes to the front and then it kind of drifts to the back. And there are actually meditation videos where that's all you do is just sort of watch the movement underwater as far as the movement and the changes in the scenery. And so using meditation or reflection or Tai Chi or Qigong or a mindfulness-based stress reduction or yoga, all of that allows you sort of to let your mind rest and be able to then restore it at the same time. So you remember, some of you are young enough to remember the 3 R's, reading and arithmetic. that we said, were the core to our knowledge. Well, these R's are the core to your well-being, is that you find something at least every day that you can do in one or more of these areas. And so you might make a list like this at home where you say, if I'm going to relax, this is what it would look like. And that's part of your option list. If I were to renew myself, this is what it would look like, or refresh, or refocus, or re-energize. So there's a song that I really like by Janice Stanfield, and if you go online, if you're comfortable on the internet, look this up and watch this video. It's very powerful in terms of what would I do if I were brave? And it has to do with the sense of, if I really were to do things that are uplifting and inspiring, what would that be? How would I take care of myself? How would I live my passion? And so you can see here are a list of 9 things that somebody drew up in a very fun way in terms of a cartoon. And I hope that when you leave here, you can be inspired to do something similar. Now, I wouldn't be very good at doing the artwork, but I could make the list. And so you can play with it for yourself. It might be cutting out pictures that really inspire you or remind you of activities that you really enjoy, that you put on a list. And then you make a decision each day to enjoy this moment, this day. And that could come in a number of ways. It can be just finding laughter wherever you can, whether it's reading something funny, being with somebody funny. I'm not very good at telling jokes, but I know some people that really are. And I love the Pickles comics. Do you ever read those that are in the newspaper? It's an older couple and how they sort of play off of each other. So there are fun places, and they're actually inspirational things that you can download or get reminders of on the internet. And then remembering to be grateful. I love this slide because it reminds us that we still have the capacity, that when we allow ourselves to be grateful, we have a whole different experience, especially in that moment. And we have a chance to say, yes, in this moment it's good. Even though I'm facing some really hard times and we might have a really uncertain, difficult future ahead, in this moment I'm grateful. And for all the others that occurred, I can remember them. And I think I mentioned in an earlier session that our body doesn't know the difference between a real or imagined experience. So when we hold a thought of gratitude, of love, compassion, we generate a whole different visceral experience in terms of even our body chemistry shifting when we hold those memories. So we can use that actually to give ourselves some relief, especially at times when it's feeling pretty intense, is to just allow that, invite that. For me, gardening is a wonderful way to enjoy my day, whether it's just planting something, pruning it, just being with my flowers. I absolutely love, and that's one of my releases. Going to a very peaceful place, really noticing what's peaceful about it, whether it's going for a walk around a lake, going out on a paddle board, whatever it might be for you, noticing the wildlife, the flowers, the beauty that's around you. And then, of course, being out in nature. We live in Colorado, and we have so much available to us everywhere we turn. But so often we take it for granted, we don't even notice it. One of the ways of well-being is really to disconnect yourself from the electronic world and just be in nature. So I like this, that there's no Wi-Fi, but you'll find a better connection, right? And the idea is to really be connected to your life. And if you have pets, those are fun. We're coming up to Halloween, so I threw this one in here because I think it's always fun to dress up pets. They have great costumes for them, if you've seen some of them. And so just having a sense of being with animals, small or large, whatever they might be, and enjoy the love and appreciation and the experiences that you have with them. They're delightful. And your whole body will change, your stress level changes just when you get to be around pets that are so loving. So in the midst of all this, we know the majority of caregivers are women. So guys, I'm not leaving you out, but I happened to see this photo and I thought it was absolutely delightful. Is that sense of when we are so overly responsible in our caregiver role, we totally forget the little kid inside of us. The time when we felt free and we absolutely had ecstasy in the playfulness of our life. So what I'm inviting you to do is go get her. And him too, and find that sense where you have fun and you can take a leap of faith into finding your joy again. And whether it's with your friends or remembering old friends or spending time with new current friends, whatever it takes that's uplifting for you, but find out what gets you to that core, that gets you excited again, and that sense of joy that you've so longed for and that you've set aside in the midst of all of your caregiving tasks. So you and everyone like you that I have ever worked with has always taught me something, and I appreciate that, and I wanted to tell you thank you, because as you know, we're always teaching each other. The question is, are we teachable? Do we allow our life and others around us to teach us? And are we grateful for the lessons they bring? I had a patient once tell me that cancer was a gift in a nasty package. Do you know what I'm talking about? So in the midst of all the pain, they were so grateful for the people that came forward that cared for them, that they never expected would be there to supportive. They were so appreciative of the things that they started to notice that they took for granted before. And it was that sense of, how do you still find that in the midst of this? Yes, you have hard work to do, and some of it's quite fulfilling and some of it's very tiring. But find that place that fills you up again. Allow yourself to have all of it, the joy as well as the challenge. And keep connecting with each other, however that is. Don't do this alone. You have a lot of support that's available to you. Allow yourself to take it in. Any thoughts or questions or comments about any of that? There are little cards on the table if you feel like you wanted to fill it out, or if you want to just tell me, I'm happy to rephrase your question or comment so that it is on the video.
I have a question. I mean, you talked earlier about kind of setting realistic expectations, but it seems like at some point there's this kind of issue of sustainability.
Mm-hmm.
I just have the sense that you kind of keep getting on the slippery slope and not realize that you're going down to these places, and then you kind of feel committed, and
Yeah.
you know, it seems like a cycle that it's not obvious that it's happening, and you know,
Very.
you just kind of read and assess what kind of expectation.
Yeah. So the question was around expectations, and that you set certain expectations for yourself and have a sense that you can sustain them, and then over time realize that maybe you can't. But you don't notice it before sometimes it's too late and you're really worn out, and it's hard to make the mid-course correction or be able to know when maybe you're getting burned out. Is that a fair summary?
Yeah.
Okay. So the idea is then really allowing yourself to check in with yourself frequently. Is maybe you decide to do this at the end of the day in terms of all the things that I feel like I have to do, can I still do them? And how well can I still do them? Are there things that I could delegate? Am I getting worn out to the point where, yes, I know I still have to do them, but I'm out of gas? How can I then fill myself up? So we go back to that list of, what are my options? If I'm feeling worn out, how do I get to this list that I created for myself to take care? So first of all is just taking the time and being willing to notice, right? Instead of just dragging our bodies through our day, doing everything we can do as fast as we can do it, and then collapsing at the end of the day. It's taking a moment where we actually reflect on it and say, how well am I doing? And you're right, there are things, as you know, this whole process is dynamic. There are times when you are doing it great, you're able to hold all the, keep all the balls in the air, as they say. and then one more thing gets added or something gets bigger, you have to shift. So it's a sense of, well, I can't do that anymore like I used to. How else can I do it? Can I either do it differently or can I delegate some of it? So it is a matter of first allowing yourself to ask the question. Sometimes we just don't do that. We just keep gutting it out and forget to check in that we have a sense of well-being and a physical, emotional, psychological well-being that needs attention. Does that answer your question?
Yeah, I mean, I think it's just something that can be very subtle. Just
It is.
Be like, oh, I'm asking you questions, but you just
Yeah.
almost don't, it's not like you're fooling yourself, but you just don't.
Yeah, so you don't realize it. And that this is, again, why it's so important to keep yourself surrounded with people who know you and care for you and can say, hey, I've noticed that you're really worn out. Can I help you with this? Or is something getting more difficult for you that maybe we could get some additional help? And so it is a matter of where you don't have to figure it out and just answer it yourself, because we can deny and just not look at some things as a way of sort of preserving our pride, maybe is a word for it, in the sense of thinking we have to do it. So now it's a matter of when we surround ourselves with people we trust, we can allow them and invite them to offer some feedback, some observations about how things are going. Mm-hmm.
With my husband, he doesn't want to burden the children, so he doesn't put the children up. But sometimes he says, and I don't know if this is similar to what you're saying, he said, sometimes I feel like, he's talking about me, that you think everything's going to be fine, that you're not facing reality. Well, you don't want to go around doom and gloom all the time.
Right.
So you avoid certain conversations. You're not really avoiding them. You talk about them when they come up, but you don't.
You don't initiate them.
No, you don't initiate. You don't obsess. You try not to obsess.
Yeah.
And I just, how do you handle that? I mean, you say yes. I realize what's going on, but
Yeah.
it's just like.
So the question was,
I don't know if I made myself clear at all, but I mean, I get that a lot, that, you seem to think that, everything's going to work out, or you're not
Yeah.
facing reality. And,
yeah,
it's, having taken over so many responsibilities, yes, you
Yeah.
are. But
I think I hear what you're saying,
you
and
don't want to make them feel guilty that you're doing these things.
right. So if I can summarize this, tell me if I'm right on target here, is the sense of you get feedback from your husband that, and maybe family members as well, that say, I don't think you realize how serious this is and you think everything's going to be okay. And your response to that is, well, I don't want to keep talking about how bad things can be because I don't want to be a doom and gloom person. I don't want to look negative. I'm just trying to hang on as best I can through all of this, which I think is actually very common. And again, it goes back to where couples or anyone in a caregiver role are really struggling with the sense of, how much can I say out loud that will change the mood? Because if I bring up this topic, that was another part of your question, is I'm thinking it, but I don't want to bring it up. If I bring this up, then are they going to think that that's all I'm thinking about? The sense of preparing for what's going to happen when you die, which is a powerful, powerful question. Pardon?
Or go through the end.
Or go through the end. How do you think that's going to be? Right. So because this is so common, the intention that I know is people are trying to protect each other. You're trying to protect each other's hearts. Yet, as you know, everybody's thinking it. Right? Everybody is. I hear it all the time that both the patient and their caregivers are really thinking the same thing. But they're both afraid to hurt each other by saying it out loud. Yet the reality is, you know your partners better than I do. And you know when there are those moments where it gets kind of quiet, where there's something going on that's just not being said. And then it becomes a little bit of a challenge with regard to who says it first, because you know something's brewing, right? So what I have found is that we are often afraid of things that we make up in our head, but there really isn't much merit to how they really will turn out. So we tell ourselves, if I say this out loud, it's going to make it look like I'm a doom and gloom person, or that that's all I'm thinking about. The truth of it is, when I find that I work with couples and they actually say, I am worried about how you're going to manage when I'm gone. And I'm wondering if you think about that too. When they begin the conversation like that, which is very supportive and kind, amazing things happen, because then people become authentic with how they're really thinking and feeling, and they don't get stuck in the emotion of this is upsetting. They start moving toward the solution. Oh, if you're worried about that, let's figure out a way to do that better. Let's make sure that you're going to have enough support, and who are the people that you can count on. And it becomes more than just the emotion of offending each other, which we think is the end game. It really becomes more solution focused, in the sense of we're working this out as a team. That's what we've been all these years, as a team. Now we're shoulder to shoulder facing this question, rather than trying to guess when is it okay to bring it up. And so the idea is that we can sort of get past our own belief about how we think it's going to be received, and actually take the risk to say it as respectfully and thoughtfully as we can. And for some people, I will encourage couples to start with that and say, I don't want to seem like this is all I think about, but I want you to know that I do think about it sometimes, and I'm wondering if it'd be okay to talk about something that's kind of serious, and it is kind of heavy for me. Let me tell you, what relief that comes when I hear couples say that to each other. Yes, the tears may come, that yes, this is hard, but then it's like, oh, we can talk about the elephant in the room. We don't have to pretend anymore. Or for our husbands or children to know that, okay, I get it. I know this is serious, and if you're wondering if I'm going to be okay, I think I will be, and these are the reasons why. Because we've done all of our estate planning, because I know the children are going to be here for me, because I have really good friends, I have a strong faith, because I know we have such a legacy that I can always draw on to bring me comfort. Yes, it will be painful, but I'm going to be okay. And so when you get to say that to each other, you know, amazing things happen. It's sort of like, oh, I don't have to carry around that secret anymore. Does that help a little bit? And those are very good questions. And I'm glad you all get to be here to know that, because I hear a lot of I see a lot of nodding, and I know these conversations happen. I hear them all the time. And the hardest part is when they're happening in isolation, when a patient tells me that, and then the family member tells me that, and they'll say, I don't want them to know I'm thinking that. And there's a part of me that giggles a little bit that says, oh, but they already are. You know, they already are, in the sense of, oh, how you could be connecting instead of carrying this pain is, you know, I have such hope for you that, wow, at least it's begun with telling someone like me, so that we can find a way that says, oh, let's find the way to connect and feel that joy and appreciation again, rather than that fear and dread. Okay. Any other questions or thoughts? Has this been helpful for you? Tell me how it's been helpful. Not that I want you to tell me that it's been great, but that I know where I had a chance to connect with you.
Well, some of it is reinforced messages I've got before, like at the very start. You have to take care of yourself first.
Yeah, reinforcing the messages of self-care. And you're right, you know, there's something really important to be said about that, is sometimes we don't get it the first time when we hear it. we sort of dismiss new ways of thinking or new considerations, right? Until we hear it a couple times. And then there's a part of our body that actually responds to it that says, yes, yes. There's an old adage, you may have heard this, that all of life lessons start out as a feather on the cheek, and when we don't get it, it eventually becomes a 2x4. And so where you allow yourself to be teachable, to where you allow support and information and new considerations, really is going to be a gift to yourself. Sometimes when we think we've just got to gut it out and figure it out on our own, we shut ourselves out from all of those possibilities, and we act on beliefs that really don't serve us very well. And then we have the 2x4 where, we're completely emotionally and physically exhausted. And then it's harder to get back up.
One of the other things is, I guess all of us have heard take care of yourself first, but looking at some of the examples, they're just things that you say, well, I can do that.
Yeah.
But they're not these huge things like you gotta go do Pilates, you gotta, it's something that's meaningful, but within your realm.
That's right.
It's nice.
And so what you notice about, yes, these lists or options are all doable. I can do that. It's not something outrageous or outside my realm. It's a matter of being willing to do them and actually making time to do them. And that's your point of power. That's the sense of, how do I fill myself up? How do I take care of myself in the midst of all these other challenges that I have to face? How do I fill up? It's sort of, are you a person that fills up your gas tank when it's on E and the light's flashing? Yeah, or are you the kind of person that says, ooh, it's getting like quarter of a tank, maybe I should fill up now? Or somebody that says, every gas station I'm going by, I'm filling up. You get to decide that. Really, this is your life, your experience. And so someone like me is just offering the information and the opportunity. What you do with it really gets to be up to you. But I'll leave you still with that thought: is suffering is optional. You don't have to suffer to, or at least not for very long.
Show the empathy, but ultimately,
Yeah. And that means saying no to some things. And that means also not tolerating bad behavior. If you happen to have someone that you're caring for who is afraid and their fear is coming out as irritability, you get to say that's not okay too. And that you can be compassionate. I know you're afraid. I know that this is really hard. But it's difficult for me to help you and really be here for you when you treat me this way. And we could actually say that to ourselves, don't you think? Because sometimes we can be pretty hard on ourselves, thinking we haven't done enough, when really we have. All right. Any other thoughts or comments or words of wisdom that you'd like to share with each other or me?
thank you very much.
Thank you.
You're welcome.